Hey everyone, this is Sarah Caudle. This is week 5, and we are talking about antibiotic stewardship. So according to the CDC, antibiotic stewardship is basically the concept that ensures that patients get the right antibiotic treatment at the right time for the right duration. And this ultimately optimizes the treatment of infection and reduces adverse effects of antibiotic use. Our role as healthcare providers, there's a few different things that we can do to ensure that the antibiotic stewardship programs are effective. A few of those include ensuring that all orders have the dose, duration, and indications, getting cultures before starting antibiotics, and reassessing antibiotic use after 48 to 72 hours. Another key point highlighted in the CDC report is quickly identifying patients that need antibiotic therapy and isolating those patients or targeting patients that have some of the more common infections like community-acquired pneumonia and UTIs. And this just ensures basically that we're the most efficient that we can be with antibiotic treatment and ensuring that those patients get what they need soon or as soon as possible before the infection requires more attention for medications or leads to worsening or development of the infection. Another thing I think we can do as nurses is educate the patient on the importance of completing their course of antibiotics. You know, if they're prescribed something and leave the hospital or the doctor's office or whatever facility you're in, educating that patient on completing the full course of antibiotics is critical so that that bacteria does not just get suppressed and weakened only to come back stronger, needing more or different antibiotics. That's how we get into these situations with super infectious staph infections and MDRO that are very difficult to treat and potentially lethal at times. So those are just a few key ways that we as healthcare providers can make an impact on the stewardship programs. So examples from clinical practice, I think this year most commonly is the flu. We had a lot of patients come in. Unfortunately, they waited until the flu had progressed into secondary infections like pneumonia or other respiratory infections. However, I did see a few cases where the physicians, if they were on the cusp of those first few days of flu-like symptoms, they would attempt to treat the patient with Tamiflu. At our facility, it was taking at least 48 hours to get flu swabs back to truly know whether the patient had the flu or not. So I think that was an example of the physicians being good stewards of our resources and of medications by at least attempting the Tamiflu for 24 to 48 hours or until we had the results of the flu swab to see if the patient truly needed antibiotics to treat a secondary infection or if this was the flu virus that was going to need to just run its course. So moving on to the using the stewardship program to treat Ebola and development of new drugs, I think this essentially is using the same concepts of the antibiotic stewardship program. So because, or we learned in the article from Celine Gounder that there's truly a limited amount of resources to treat Ebola. So I think using these concepts of good stewardship and ensuring that we're making the best of what resources we have is very important when treating this super contagious and lethal virus. A few of those things that we can do, or the same concepts we can use, are identifying those that are infected quickly, tracking them, isolating them, collecting as much data as we possibly can so that we're properly managing the resources that we have. And ensuring that not only are that data being collected and those medications being monitored to see which are most effective in the treatment of Ebola, we're also treating those patients with supportive measures, making sure that we're keeping their blood pressure elevated enough, ensuring that they have proper nutritional support. All of those things are going to play a key role in healing and ultimately getting over the Ebola virus. But if we don't also maintain those things, then the resources that we've used or medications that we've used to treat Ebola they're going to go to waste. So those are just a few of the key concepts from the antibiotic stewardship program that we can translate over into the treatment of Ebola and the development of new drugs. Looking forward to hearing you guys, your synopsis of this week's discussion, and see you soon.